In today's tutorial, we'll discuss with you guys the differentiation in a very easy and conceptual way among these terms: antiseptics, disinfectant, disinfection, sterilization, antibiotics, antiviral, antifungal. So let's start from the very first. What is antiseptic, or what are the antiseptics? Simple question. And here we have actually two definitions. The very first definition is the one that is circulating all around, and that is a kind incomplete definition. And the very second one will be the comprehensive definition and the very logical definition. Let's discuss the very first one. According to the first definition, antiseptics are the chemical agents that are used on the external surface of the body in order to stop the growth or kill the microorganisms. Simple. The antiseptics are the chemical agents that are used on external surface of the body to remove, means to kill, or to stop the growth of the microorganism on the external surface of the body. This is the first definition. Before I move toward the second definition, I want you guys to know about urinary tract antiseptics. Now, concentrate this term, urinary tract antiseptics, such antiseptics that are used in the urinary tract. Now, our first definition is somehow going to be wrong. Why? According to the first definition, we got the concept that in the first definition, this is the simple definition according to the public, antiseptics are used externally. Where? On the body, external surface of the body. But here we got that urinary tract antiseptics, such antiseptics that are used in the urinary tract, means these antiseptics will go and they will show their action in the urinary tract. So now urinary tract is actually a kind internal. So it is not external surface of the body. So like this first definition is a kind of confusing definition. Why? Because most of us, we don't know about urinary tract antiseptics. We come to know about these antiseptics when we are studying the pharmacology. According to the pharmacology, we have nitrofurantoin, methenamine. They are actually the antiseptics that are acting in the urinary tract. So from now onwards, whenever you are asked about the antiseptics, you must reply, these are the chemical agents that either stop the growth of the microorganism or they kill the microorganisms locally, at specific area, at a particular area. So now this definition covers your both the types of the antiseptics that you are using on the external surface of the body, and the urinary tract antiseptics, means the antiseptics that you are using in the urinary tract. So these antiseptics are actually acting locally in the urinary tract. If you take these antiseptics, they will move through your GIT and will reach the urinary tract, and they will show their particular action in the urinary tract, means local action. So they are showing the local actions. And obviously, when we are using antiseptics on the external surface, again they are showing the local action. So like this, if you are using the word local, then this definition will become a kind of comprehensive definition. So now once again, what is this comprehensive definition? The very specific definition of the antiseptics. Antiseptics are the chemical agents that either stop the growth of the microorganisms or kill microorganisms locally. Okay, simple. I hope you got. Now let's come towards the next one, that is disinfectant. Again, the chemical agents that are used to remove the microorganisms from the inanimate surfaces, means the non-living surfaces, in short, like table, floor, etc. And we have disinfection. This is actually a kind of process of using the disinfectant and antiseptics. Okay, disinfection is actually the process. And the next one is sterilization. It is also a process. Now, what is the difference between these processes? That is the very reason that I wrote disinfection and sterilization. Very simple. By definition, when we are using the disinfectants, by means of disinfectants means during the disinfection process, we actually remove about 90% or somehow more, but less than 100%. Okay, microorganisms are actually removed from the non-living surface. Whereas according to the sterilization, it is known that by sterilization process we actually remove nearly 100% microorganisms from the non-living surfaces. The very accurate and authentic process to remove the non-living microorganisms from the non-living surfaces. So according to this disinfection, we remove nearly about 90%, more than 90%, but less than 100%. And according to sterilization, we remove about 100%. And the next one is antibiotics. Antibiotics, such chemical agents that are used against the bacteria. These are also called as antibacterial. So such chemical agents that are used against microorganisms like bacteria. And the next one is antiviral. So our antibiotics are not seen effective against antiviral. That's why for viral infection we are supposed to use some certain types of the chemical agents named as antiviral. And antifungal, the name indicates again, antiviral, antifungal, these are actually very easy terms because we can identify from the name. Antifungal are the chemical agents used against fungi. So that's it from my side regarding these terms. If still you have a confusion or a question, drop that in the comment box.